Good morning, everyone. In this video, we will learn about the analysis of posture. Postural analysis is the systematic assessment of the alignment of body segments in relation to each other. Postural analysis is the systematic assessment of the alignment of body segments in relation to each other. It is used to identify normal and abnormal postural patterns and detect any deviations that may lead to pain, discomfort, or functional limitations. Postural analysis helps physiotherapists evaluate body alignment, muscle balance, joint position, and movement efficiency. It is an important component of physical examination and play a key role in planning treatment and postural correction programs. In this presentation, we will discuss the principles, methods, and the importance of postural analysis in clinical practice. First, let us understand the normal curvature of the spine. The vertebral column is not straight, it has normal physiological curves that help maintain balance, absorb shock, and distribute body weight efficiently. The normal curvature of the spine are cervical lordosis, thoracic hyposis, lumbar lordosis, and sacral hyposis. An inward curve in the neck region that is called cervical lordosis. An outward curve in the upper back region is called thoracic hyposis. An inward curve in the lower back region is lumbar lordosis. An outward curve in the sacral region is called sacral hyposis. These normal spinal curves provide flexibility, stability, and efficient posture. Any increase, decrease, or abnormal deviation of these curves can lead to postural abnormalities and musculoskeletal problems. After understanding the normal curvature of this spine, let us discuss posture assessment. Posture assessment is the systematic evaluation of body alignment to identify normal posture, postural deviations, and potential musculoskeletal problems. During posture assessment, the body is observed from the anterior, lateral, and posterior views. No movements in the atlanto-occipital or atlanto-axial joint which result in protrusion of the jaw. Stand as straight as possible. Knee should be straight as much be possible. The other assessments include position of the head and neck, shoulder level and symmetry, spinal alignment and curvatures, pelvic position and tilt, hip and knee alignment, foot position and arches. Various methods such as visual observation, plumb line assessment, postural grids, photographs, and postural measurement tools may be used. Posture assessment helps in early detection of abnormalities, planning appropriate treatment, and monitoring the progress of postural correction programs. For accurate postural assessment, the body should be observed from three different views: anterior view, posterior view, and lateral view. The part which are important to observe: head alignment, curvature of the spine, cervical, thoracic, and lumbar. Third one is shoulders and arm, pelvic inclination, hip, knee, and angle joint. Angle joint. First, we look at the anterior view. Observe head position and facial symmetry. Check shoulder level. Assess the alignment of hips, knee, and feet. Look for anybody asymmetry. Lateral view. Observe the alignment of the ear, shoulder, hip, knee, and angle. Assess the normal spinal curvature. Check pelvic tilt and overall body balance. Next, we look at the posterior view, back view. posterior view or back view. Observe the alignment of the head, shoulders, and spine. Checks scapular position. Assess pelvic symmetry and leg alignment. Look for scoliosis or other spinal deviations. Assessment from all three views helps identify postural abnormalities accurately and assist in planning appropriate treatment. Okay, next we will look at the part parts important to observe during postural assessment. During postural assessment, certain body parts should be carefully observed to identify any postural deviations. The important parts to be observed are head and neck position, tilt and alignment, shoulder level symmetry and rounding, scapulae position in prominence, spine, cervical thoracic and lumbar curvatures, pelvis, pelvic tilt and asymmetry, hips alignment at the level, knees, look at genu valgum, genu varum or genu recurvatum, ankle and feet, look at the foot arches, toe positions and weight distribution. Careful observation of these body parts help detect the postural abnormalities and plan appropriate corrective measures. Next, we discuss correct posture. Correct posture is the ideal alignment of the body in which the line of gravity passes through the body's center, placing minimal stress on the muscle. Stress on the muscles, ligaments, and joint. Characteristics of correct posture include head held erect with the chin slightly tucked, then shoulder level and relaxed, chest comfortably elevated, normal spinal curves maintained, pelvis in a neutral position, hips and knee aligned properly, feet placed comfortably upward with weight distributed evenly. Correct posture promotes balance, efficient movement, proper breathing, and reduce the risk of pain and musculoskeletal disorder. It also improves appearance and confidence. Next, we look at the types of poor posture from the lateral view. When viewed from the side, several postural abnormalities can be identified. These are commonly known as poor posture from the lateral views. The main types are hypotic posture, increased thoracic kyphosis, and forward head and rounded shoulder. Lordotic posture, increased lumbar lordosis, anterior pelvic tilt and protruding abdomen. Hypolordotic posture, combination of increased thoracic kyphosis and lumbar lordosis. Forward head, rounded shoulder and anterior pelvic tilt. Flat back posture, decreased lumbar lordosis, posterior pelvic tilt and flattened spinal curves. Sway back posture, pelvis displaced forward with posterior pelvic tilt. Trunk leans backward and head often project forward. Identifying these postural deviations helps physiotherapist plan appropriate corrective exercise and treatment. Next, we look at the now let us discuss hypolordotic posture. One of the common postural abnormalities seen from the lateral view. Hypolordotic posture is characterized by an increased thoracic kyphosis along with an increased lumbar lordosis. The typical features include forward head position, rounded shoulder, then increased thoracic curvature, increased lumbar curvature, anterior pelvic tilt, protruding abdomen. These postures result from muscle imbalance, muscle imbalance, poor postural habit, weakness of abdominal muscles, and prolonged faulty positioning. Hypolordotic posture can lead to back pain, muscle fatigue, and reduced postural efficiency. Treatment includes postural correction, strengthening of weak muscle, stretching of tight muscles, and ergonomic advice. Next, we look at the flat back posture. Flat back posture is postural deformity characterized by a decrease or loss of the normal lumbar lordosis. As a result, the lower back appears the flat. The typical features include flattened lumbar spine, posterior pelvic tilt, reduced spinal curvature, forward trunk inclination, hips and knee may be slightly flexed. Flat back posture may result from muscle imbalance, poor postural habits, uh, certain spinal conditions. Individuals with a flat back posture may experience back pain, muscle fatigue, reduced shock absorption, and difficulty maintaining an upright standing position. Management includes postural re education, strengthening exercises, stretching exercise, and correction of faulty postural habit. Next, we look at the lordotic posture. Uh, the lordotic posture is postural deformity characterized by an exaggerated inward curvature of the lower lumbar spine known as increased lumbar lordosis. The characteristic features include increased lumbar curve, anterior pelvic tilt, protruding abdomen, increased hip flexion, sometimes hyperextended knees. Lordotic posture commonly results from muscle imbalance, weak abdominal muscles, tight hip flexors, obesity, pregnancy, or poor postural habits. Individuals with lordotic posture may experience low back pain, muscle fatigue, and reduced postural efficiency. Management includes postural re-education, strengthening of abdominal and gluteal muscles, stretching of tight hip flexors and lumbar muscles, and correction of faulty postural habits. Next, we look at the evaluation of posture. After identifying the different postural patterns and abnormalities, the next step is posture evaluation. Posture evaluation is the process of examining and measuring body alignment, to determine the presence and severity of postural deviations. The evaluations include observation from anterior, lateral, and posterior view, assessment of spinal curvatures, evaluation of head, shoulder, pelvic, knee, and foot alignment, measurement of joint range of motion, assessment of muscle strength and muscle length, identification of muscle tightness and weakness, analysis of functional activities such as sitting, standing, and walking. Various tools such as plumb line, poster grid, goniometer, and photographs and postural assessment chart may be used. Postural evaluation helps in diagnosing abnormalities, planning treatment, and monitoring improvement during rehabilitation. Now, let us discuss postural evaluation from the posterior view. Posterior evaluation is performed by observing the patient from beginning to assess a symmetry and alignment of body structures. The following points should be observed. Head position should be centered and not tilted. Shoulder should be at the same level. Scapula should be symmetrical and lie flat against the thoracic wall. The spinal column should appear straight without lateral deviation. The waist angle should be equal on both sides. The pelvic should be level and symmetrical. The knee should be aligned properly. The Achilles tendon should be straight. The feet should be symmetrical without excessive pronation or supination. Posterior evaluations helps identify conditions such as scoliosis, uneven shoulders, pelvis asymmetry, and other postural abnormalities. Okay. Now let us discuss postural evaluation from anterior view. Kneecaps face right ahead. Legs are straight up and down. Toes are straight. Arches have normal half dome shape. Now let us discuss postural evaluation from the anterior view. Foot supination and pronation, slight knee knocking, feet are pronated. Now let us discuss postural evaluation from the posterior view. Plumb alignment between the heels. Things to examine: note alignment of Achilles tendon, hip adduction and abduction. Check for level posterior iliac spine and check for the level lateral pelvic tip and check for spine and shoulder problems. Now let us discuss scoliosis, a common postural deformity of the spine. Scoliosis is lateral curvature of the spine that is often accompanied by rotation of the vertebra. Instead of appearing straight, the spine curves to one side, forming C or S-shaped curve. Clinical features include types of scoliosis: congenital scoliosis, neuromuscular scoliosis, and paralytic and idiopathic scoliosis. Clinical features include uneven shoulders, prominent scapula on one side, unequal waist angles, pelvic asymmetry, trunk deviation to one side. If left untreated, scoliosis may lead to postural imbalance, back pain, and reduced respiratory function in severe cases. Management depends on the severity and may include observation, postural exercises, physiotherapy, bracing, or surgery. Early detection through proper postural assessment is important for effective management of scoliosis. Now let us discuss postural re-education. Postural re-education is the process of correcting faulty posture and teaching an individual to maintain proper body alignment during daily activities. The main goals of postural re-education are to correct postural abnormalities, to improve body alignment, to reduce pain and discomfort, to prevent musculoskeletal problems, to improve functional efficiency. Postural re-education include postural awareness training, strengthening weak muscles, stretching tight muscles, balance and coordination exercises, ergonomic advice, practice of correct posture during sitting and walking and working activities. Regular practice and patience education are essential for achieving and maintaining good posture. Therefore, postural re-education plays an important role in improving posture, functions, and overall quality of life. Now, let us discuss the practice of correct posture during sitting. Correct sitting posture. Correct sitting posture helps reduce strain on the spine and prevent neck and back pain. While sitting, keep the head upright and look straight ahead. Maintain the natural curves of the spine. Keep the shoulders relaxed and level. Sit with the back supported against the chair. Keep both feet flat on the floor. Keeps and knees should be bend approximately 90 degree. Distribute body weight evenly on both hips. Avoid leaning forward for prolonged period. Maintaining proper sitting posture improves comfort, reduces fatigue, and promotes musculoskeletal health. Now let us discuss the practice of correct posture during standing. Correct standing posture helps maintain balance and reduce stress on the muscles and joint. While standing, keep the head While standing, keep the head erect and chin slightly tucked. Look straight ahead. Keep the shoulder relaxed and level. Maintain the normal curve of the spine. Hold the abdomen gently contracted. Keep the pelvis in a neutral position. Keep the knee straight but not locked. Distribute the body weight equally on both feet. Keep the feet slightly apart for a stable base of support. Support maintaining proper standing posture, improve stability, reduce fatigue, and helps prevent postural problems and back pain. Now let us discuss the practice of correct posture during walking. Proper posture during walking promotes efficient movement and helps prevent strain on the body. While walking, keep the head erect and look straight ahead. Maintain relaxed shoulder. Keep the back straight and maintain normal spinal curves. Gently tighten the abdominal muscles for trunk stability. Swing the arm naturally in coordination with the legs. Take smooth, comfortable steps. Allow the heels to strike the ground first, followed by the forefoot. Keep body weight balanced and avoid excessive leaning forward or backward. Maintaining correct walking posture improves balance, coordination, and energy efficiency while reducing the risk of pain and injury. Finally, let us discuss the practice of correct posture during working activities. Maintaining correct posture during work is important to prevent fatigue, muscle strain, and musculoskeletal disorder. During working activities, sit or stand with proper body alignment. Keep the head and neck in a neutral position. Maintain relaxed shoulder and straight back. Position the workstation at a comfortable height. Keep frequency used item within easy reach. Avoid prolonged bending, twisting, or awkward postures. Take regular breaks to stretch and change position. Use proper lifting techniques when handling object. Good working posture improves comfort and overall musculoskeletal health while reducing the risk of related injury. Okay, let us briefly summarize today's presentation. Today we discussed the analysis of posture and its importance in physiotherapy. We learned about the normal curvature of the spine, posture assessment from anterior, lateral, and posterior view, important body parts to observe during postural assessment, characteristics of correct posture, types of poor posture, including hypotic, lordotic, hypolordotic, flat back, and sway back posture, evaluation of posture and posterior view assessment, scoliosis and its clinical features. Postural analysis helps identify abnormalities, early plan appropriate treatment, and improve overall body alignment and function and quality of life. Proper posture is essential for maintaining balance, preventing pain, and promoting musculoskeletal health. Thank you.